We're going to wake you up in a much more intriguing and important way, I think, dealing with the reality in America. So this is very US focused, but the implications are for the whole world. Maternal health, women are the backbone of every economy on the planet. They certainly are in America. I didn't make that up. The Treasury Department in the United States said that in 2010 in a report. The way we're going to wake you up, you don't need caffeine, because we're going to tell you a few of the statistics that Jill said we would talk about. There are two things to think about. One is maternal health. That is moms who die in the course of being pregnant or in delivering. And in the States, US, we rank 33rd of 179 countries, and we're the worst in that statistically of all developed countries in the world. If that didn't sober you enough, we do really poorly with infant mortality. And infant mortality is designed as babies who die within the first year of life. So we rank really poorly there as well. The number, and I want to get it exactly right, is 17.8 infant deaths per 100,000. That has nearly tripled since 1978 in America, and we will talk about what factors have made that worse in America. So there are lots of statistics on this, and we woke you up with those two. That's sort of the basis for why we're here. The answer to this is not on the floor of CES in one booth. There are many tactics you'll find there, and those in combination with lots of stuff we're going to talk about here is what's going to help this challenge. So your panel, as you can see, is very diverse in every way diversity can be defined. We've got someone who has been active in politics, still is, Representative Dick Gephardt, the Honorable Dick Gephardt, Democrat, Missouri. We've got Dr. Smith from NASA. What's he doing here, you're wondering? We've got Chanel. Chanel is a magnificent doula, and she'll tell you what a doula is if you don't know, because you should. And she's working in New York City with women who should be addressed in this situation and doing a great job there. And then Murad, who is the founder of Square Roots, and that's where we're going to start with this conversation. Why was Square Roots started, Murad? Sure. What's your motivation? And tell us where you come from, because you're not a tech developer either.
No, I'm not. So we really started Square Roots as a discovery project. It wasn't meant to be a company. I'd worked with Dick over the last 6 years, and we started in response to these statistics that you mentioned. And as we started going around to a lot of these places, whether it was the Mayo Clinic or Harvard Medical School or Brigham Women's or UCSF, and meeting with their prenatal doctors, we kept hearing things that were really shocking, not just from an epidemic point of view of care, but we were learning things about the science of pregnancy that were really shocking to us, at least to me as a layman. So 70% of the brain develops during the fetal period. 70%. So it's disproportionately important to focus on pregnancy for your future health. So as somebody who comes from a life science background, having started a company that worked for many years in developing standards around how we should live, it was almost the most obvious place to start. If you're looking at lifelong health, you must look at pregnancy. And as we started assembling kind of this brain trust of incredible leaders and thought leaders and thinkers and doctors, we started learning these fascinating points, and I kept getting the same takeaway, which is, does everybody know this? So in your third trimester, if you're fed antioxidants, it improves your brain growth. Does everybody know that? And if not, why not? So what we learned quickly was that all of the latest academia and science was really staying within academia and science, and there was no translation into families. So we felt we had a role to play and realized it was in organizing the science, first of all, and then in taking action now and not talking about developing something in the future. So what we did was look at the US Conference of Mayors and looked at the policy landscape, and because we knew that that would be a starting point that would be necessary no matter what. And we passed the first resolution in 82 years on maternal health in June, which means all 1,300 US mayors now have on their agenda maternal health.
And I'm from Philadelphia, so my mayor, Michael Nutter, was one
That's
to
right.
sign.
Yes, he was.
He's a big supporter of that, and
Yeah.
we certainly need that in Philadelphia as
Yeah.
well. So that's great.
Yeah.
So if you go to squareroots.com, and I'm not telling you to do that this minute, but do go to squareroots.com, because when you do, you will see an intriguing periodic chart of the social determinants of health for pregnancy. And those are the kinds of things we're going to talk about now. We're not going to talk about technology for a few more minutes.
Sure.
We're going to talk about food and spirit and mental health and safe housing and water and all of that and public policy. So let's talk about, I think I'd like to start with the mental health piece and the spiritual health piece with our doula. Could you tell everybody, Chanel, what a doula does?
So a doula is someone who offers emotional and physical support as well as advocacy through preconception, interconception, and post-conception care. So basically, when you're deciding and you're thinking about, I want to get pregnant, telling you and giving you the information that you need so you can make an informed decision about your care. And then we follow you throughout your pregnancy, assisting you with check-ins and addressing fears and concerns, taking into account maybe any kind of past trauma that you've experienced. We attend your birth. We stay with you the entire time, helping you to cope with childbirth because it's a process. And then afterwards, really connecting with the mom and the child in that development period where that bonding comes into play. So staying with the family and trying to work with them. And my particular program with Ancient Song, we stay with the mom for up to a year, really guiding and being there for them to answer any kind of questions they may have. So, you know, it's one thing to tell someone to breastfeed, right? It's another thing to be able to guide someone through the process.
Great. So speaking of Ancient Song, if you're tweeting, Chanel is Ancient Song 7. I'm Healthy Thinker, and our three gentlemen do not have Twitter handles, which is an interesting data point at CES. And I'll leave that there. This is about maternal health, so we're going to speak generally still about now food. And Dr. Smith, the NASA scientist, what the heck's he doing here? He's going to tell you. Talk to us.
Well, in a way, I have the same question. What I do is lead the Nutritional Biochemistry Lab at NASA, which is NASA's focus on nutrition in keeping astronauts healthy during spaceflight. So right now we're dealing with crew members on the International Space Station, and we do a lot of work with them to make sure they're healthy when they go up. We track dietary intake while they're up there, and we're doing a fair amount of research trying to understand how the body changes during spaceflight. And from my knothole, the question becomes, what can nutrition do to help keep astronauts healthy? And there's many examples of that, but the more obvious related to NASA's issues are things like vitamin D status, because vitamin D deficiency is an issue in astronauts because they don't get any sunlight exposure. Bone loss is a big deal for astronauts because without weight bearing, your body, being very smart, realizes that it doesn't need the skeleton that it did on the ground, so it starts breaking it down. And what we're trying to do is figure out how to convince it to keep it. One of the bigger issues that's jumped up in the last 5 or 6 years is astronauts are developing vision issues. That is, people are going up with perfect vision that when they land need glasses and years afterwards still do. That was something that we, again, did not realize was a problem 5 or 6 years ago. From a nutrition perspective, what we've found, and we actually just published a paper this week, is that there's an interrelationship of an individual's genetics and their nutritional status, which affects them getting these vision issues. So not everybody on space station gets these vision issues, only a subset of the astronauts. So we're trying to figure out what it is. And again, we've just published a first step in trying to go down that pathway. We still don't know what the mechanism is, but we know, in a way, one of the things that is affecting that, and we need to chase that down. One of the more intriguing things that we've found is that in looking at astronauts that develop vision issues, there's a number of characteristics that they have. We found a clinical population on Earth that, just from reading the literature, has many of the same characteristics. Things like intracranial hypertension, thicker nerves, running from the eye to the brain, altered hormone levels, altered carbohydrate metabolism, a long list of things that are very similar between our astronauts and this clinical population. Now, this clinical population is women with what's known as polycystic ovary syndrome, or PCOS, which is the leading cause of infertility in women. It affects 10 to 15% of the population. And we're looking at this now as, again, speculating that by studying women with PCOS, we may be able to understand how astronauts develop vision changes during spaceflight. And the give and take between the work we do at NASA and the implications for people on Earth and vice versa are profound. So in many ways, there's a lot of interrelationship. And to come back to the basic question, nutrition is one of the key regulating factors. It's one of the key environmental factors, as we call it. It's one of the key things that you can change that will affect your health. And while that's important throughout your life cycle, it's probably no more important than during pregnancy and in the early years after birth. So while it seems a very distant stretch, there's obviously a lot of linkage between what we do at NASA and what these other folks do.
And that's the reason I answered Jill's question about healthy, low-price food GPS app for people, because food is a key social determinant of health. And if it's not available or well-priced, then you get into financial wellness issues, which then get into health problems. So, and public policy has something to do with food and big food. And speaking of public policy, we have Dick Gephardt here on our panel, and so honored to have him here at CES, but especially right here. Talk to us about your perspective on this whole maternal child health issue from what you learned in the Beltway all those years and what you're doing now.
Well, let me first say that it's my honor to be here. And secondly, I'm here because I've worked with Murad for about the last 6-7 years. And his genius is that he looks at things that we all know about and we know are important, but he really focuses like a laser beam and helps us try to figure out how to do better with wellness real estate, which is what he started with, and now maternal and infant health. I've learned so much from our meetings. We've been, as he said, to Harvard and Mayo and UCSF. And what we've discovered is that there's a whole body of information, a huge amount of information, that nobody has kind of organized and brought to the table to try to do better everywhere in the world with maternal and infant health. And there's a lot of policy prescriptions that we can bring to the table, and we need to, like bills in Congress or in state legislatures to give people family leave for pregnancy, or maternal health advocacy for women who are in pregnancy. And there are a lot of scientific things we can do, like the doctor just talked about from NASA. And there are a lot of just local initiatives. We're trying to do something in the state of Mississippi with mayors and cities to establish homes where women who are from poor circumstances can come, as she is doing in New York and many other places, so they have the information, the help, the care that they need to really have a successful pregnancy. Let me just mention two of the scientific discoveries we've made that will give you a better understanding of what we're trying to bring to the table. At Harvard, we learned that the brain is completely wired during pregnancy. I mean, we always thought once the child is born, then, they need nutrition and so on and so forth, so that they wire the brain correctly. It's wired by the conversation that the mother has with other people. It's words that are spoken while the child is in the womb that wires the brain. I mean, who knew this? I didn't know it. We didn't know it. Nobody knows it. So you've got this great research, but nobody is getting it into the population here or anywhere to help people know what to do. Let me give you another fact. In the last 20 years, we've made great technological progress in allowing premature born children to survive. We've made huge strides. But what we now understand through research is that most of those premature children born are going to necessarily have some pretty important both mental and physical challenges, simply because they didn't come to term. So trying to figure out, we've done good at that. That's a great thing. That's a wonderful development. But now we got to focus on how do we help women bring babies to term.
Right.
And some of it is knowable. Some of it needs more research. Some of it is nutrition. Some of it is a lot of other factors that surround a pregnancy. But just bringing the science to technology and policy is really what our goal is. So we're really in an understanding phase, which is, again, his great genius, is that he focuses and tries to get all the information you can get, and then we'll start bringing out ideas, both apps, technology, policy prescriptions, homes and cities, ways to bring people together to help one another, a whole series of prescriptions to try to, again, advance maternal and child health.
Is that in the U.S. we're really good at rescue and curing and saving. We spend a fortune, more than any country in the world, and per capita, per person, we spend more than anyone, and we still have these miserable outcomes, not just for mother and infant health, but also for just the general population as well. But if we go back in the value chain, earlier in life to pre-life, to women's health and men's health too, people's health in America, make the investment earlier, then the ROI will be tremendous in both living and resiliency, but also in the economy, which is something that I think about, the macroeconomy of the nation and the microeconomy of the home and the household. So speaking of then all this information and technology, Square Roots recognize the importance of data and information. So one of the early investments you've made has to do with that. Now we're moving into the technology part of the discussion. Yeah. So talk to us about the rationale and what you acquired.
So there's this body of science that we all talk about and information. It's not organized, and it's not distilled in usable ways. So we knew that immediately that was going to be one of the key first steps, that as a function we could be valuable to moms in doing. So we acquired a company that's helping us do that. But we're still working with a lot of other partners because it's not so simple. It's really not one-dimensional. It's not just creating a new hub or a new portal that now has all this information and then you run different tools off of it. It's not that simple. If you look at the landscape of what's actually happening, 50% of pregnancies are Medicaid. We were talking backstage about you could have a smartphone, but maybe not have a data plan on a smartphone. There's so many intricacies that are overlooked when we create a tool and just throw it out there. And we're really shining the apple of a lot of the same things often. And I think there's a combination and multiple dimensions of solutions that take a long time to put together. And that definitely includes information, it definitely includes technology, but it also includes policy. We're taking steps in multiple directions towards those aims, but it's not as simple as we acquired a company and now we're introducing our solution, because it takes a long time.
Absolutely. Yeah. Chanel, you've had experience using technology. A doula is considered, soft science, but in fact, doulas use technology too. What have you learned from your deployment of technology, use of technology with women?
Well, we've used formulations of care guides and different products to be able to bring across to a wider scope to individuals that we serve, right? But also taking into account the cultural relevance in the product that we're presenting to the individual? Does it speak to them? Does it have a literacy factor that they're able to understand? And that's where I think, being in this particular room with all of you, you have the keys to be able to develop that kind of science and that kind of technology that is important. The infant mortality rate in the United States is poor. We are one of the most industrialized and developed countries, and yet women or children are still dying in childbirth. And a lot of that has to do with the fact that the overuse of technology within birth. Birthing is something that is very natural. We've been doing it since the beginning of time, way before any of these smartphones or anything was available. And I definitely think that technology and tech, it plays a huge role in how we converse, right? Because a lot of the women in the populations that I serve, which are underserved populations of low-income families, immigrant communities, people of color, who otherwise wouldn't necessarily be able to get information, as was said by Murad, they have smartphones, but yet don't have data plans. So what does that mean? How are they getting the information that is necessary to be able to help them throughout the life course, to be able to improve the infant and maternal mortality? So it's up to all of us sitting here up at the table, in terms of policy, in terms of the life sciences and the data, to be able to really find a way to bridge that gap and that barrier so that everyone can feel like they're invested within the model of care that best suits them and where they are at that particular moment. We were also speaking in the back about how we have all this technology, but then there's no touch. So we become so involved within data, and that we forget that there's another part of life that is interconnected, right? When you receive a text message, sometimes, you don't realize how you can feel someone's emotions across that text message. When someone's angry, when someone is is really joyful and excited. And we need to find ways to really bring that together and make it more cohesive so that, women and families feel like they're being supported.
Yeah, is this on? I've been taken off my other mic. In the context of, again, the floor at CES with these marvelous technologies, do not underestimate the power of a well-worded text message. Texting for health is still very powerful, and if you're in healthcare, it's really cheap to do.
Yes.
And you can target your population. So don't overlook texting for health.
Right, or Facebook.
or social networks.
Yes, social media is amazing, just in terms of being able to stay in contact with a lot of the populations that we serve. A lot of that has come through Facebook or using Twitter or Instagram, to send a picture about, there's a prenatal class today, you should come. And showing that picture of other women being there and the collectiveness of that makes them say, oh, you know what, I need to be there. So really taking those things into consideration when you're developing.
Yeah. Health really is a social game.
Yes.
A social phenomenon, right?
Yes.
So with respect to food and all the knowledge that we know about the importance of food in health and particularly in pre-pregnancy and pregnancy, Dr. Smith, how do we take that, translate everything you and your colleagues know and bring it down literally to earth, to real people?
Well, as with many of the things we talked about here this morning, it's not easy. And I think that's one of the things that's been frustrating for everybody, that the nutrition messages that are delivered seem to continually change. And that one day eggs are bad for you, the next day eggs are good for you. One day meat is bad for you, the next day it's good for you. And deciphering the information isn't easy. And some of that stems from the fact that doing the research isn't easy, and that doing different studies, a finding from one study doesn't tell you much of anything. You've got to replicate it, you've got to do it in different populations with different controlled situations and uncontrolled situations and make sure you get the same answer. And that's, again, disseminating information that is palatable at all levels, pun intended, is a challenge. And then, one of the other things that we've sort of touched on, the psychology behind a lot of this, the psychology behind food, is extremely intense. Again, we find that a lot during spaceflight, because when we put people in relatively sterile environments, far from home, relatively isolated, you can't get back easily, food becomes very, very important. It's one of the few things that remind you of home. You know, comfort foods, the whole notion of that is a big deal. And again, when we look at trying to change people's behaviors on Earth, it's a battle. It's a battle.
Do you think technology can play a role in a kind of cognitive behavioral therapy way or other way to change behavior, to help nudge people to healthy food decisions?
Indeed, I think there's a lot of ways that could happen, that there are possibilities there, sure.
So you can look for some of those kinds of tools on the floor of CES. For example, yesterday down in Eureka, and go downstairs to the 80,000 booths, because that's where the new things are happening, new research, kind of untested, kind of tested. But check out, for example, I have no skin in this game, the guys who invented Spoon, S-P-U-N with an umlaut under the U, though they're not German, they're American. A lawyer, an investment banker, and a PhD food scientist retired out of Nestle, Kraft, etc., who admits that he had built a lot of the fat-free foods that have made people fat now, and in his mature age, this is his legacy, to help people portion control through a connected utensil. Fascinating. That's one tool I think could be really useful for me too, by the way. Representative Gephardt. So we're skirting around a lot of issues about policy, and we have an election in the states just over a year from now, as if y'all didn't know.
I haven't heard about that.
Yeah, no, it's just craziness. So I'd be ridiculous not to ask you sort of your outlook for especially health policy in general, and then how do you think women and children will fare? I know it's a scenario, it's a lot of wild cards, but what's your read right now into sort of the 1-3 year look at this?
Well, whoever gets elected, I think it's really important that efforts like this put information out to the public so that the right, better decisions can be made. Let me give you a couple of statistics. We today spend 40% of Medicare is on end of life. Let me say that again. Medicare is incidentally the biggest and the most growing part of our federal budget, and 40 to 50% of its expenditures are on end of life events. I dare say that if you went to Medicaid, and he was saying before, 50% of Medicaid, 50% of pregnant women are in Medicaid.
Yes.
In the United States today. Yep. I dare say that pregnant women and early childhood does not claim nearly 40% of the Medicaid budget.
Right.
So not only are we not spending enough on the beginning of life,
yes.
which is a little important.
Like, yes.
I'm not going to say it's more important than end of life, because I don't want to get into that subject, but we're not just spending enough, we're not spending it effectively, which is what we're talking about here.
Exactly.
We're not getting, your great science and the skills you have in technology applied enough to be able to help people behave better. 80% of your health status is your own behavior, maybe 70%. Maybe 20% is your genes, 10% your environment. The rest of it is the way you behave, what you eat, the way you exercise, what you do. And so if we can figure out how to use some of that budget from a policy standpoint to better affect preventative behavior, proper behavior, healthy behavior on the part of individual women, men, children, then we're really moving in the right direction in policy. And that's what we're trying to bring forward, are those ideas so that policymakers can embrace them and bring them into these very policy areas.
Can I say something? Yeah, and I love that you brought that up. About 95% of the women in the population that I serve are on Medicaid. And the different barriers that they see in order to get care as opposed to someone who has private insurance is horrific. A doula is seen as someone who provides preventative care, and that's how we have to be looked at, not as a luxury. And in seeing us as someone and an individual who provides preventative care, you know, it's been seen even in the Cochrane report that we lower cesarean rates by 28%. Low birth weight babies, preterm babies. So, you know, a doula, we're not allowed to accept Medicaid. You know, we're not given the opportunity. So, you know, where it comes where a doula is seen as something as a luxury for those who can afford to pay $3,000 upwards for services, they can. But then what about the individual who can't? Why can't they still get that, you know, quality and equitable care that is needed so that they can have a healthy pregnancy? And that's what's really important. You know, I was in a meeting just yesterday with, you know, New York City Council and some state representatives in regards to trying to build a platform so that we can get, you know, we can accept Medicaid so that we can provide that preventative care because it's so important, you know, and being able to provide that tech behind that would be amazing. You know, it'd be something that could really push forward and really help to really tackle the infant and maternal mortality within the US.
And if you want to talk about economics, I mean, just imagine if you could bring more babies to term, you save huge amounts of dollars because they're not facing those physical and mental challenges that preemies face.
Right.
So it's an incredibly smart investment, but we're just not doing it well enough.
So we have to send Chanel to the Conference of Governors, the National Council of State Legislatures, and send them the Cochrane Report.
Yeah.
And the Cochrane Report, just so you know, because we don't want to be wonky, publishes cost effectiveness information on lots of procedures and other healthcare interventions. So we love the Cochrane Report. People like Gephardt and me and others, the whole panel. That's so important. Also, note on the floor at CES, you'll see a huge booth from United Healthcare. So we talk about public policy and Medicaid and state governors as payers, but don't forget, there are private payers who may also consider paying for doula services as well, who face the same issues with medical loss ratios in the real world of being publicly traded companies. So this is a wise investment for all payers, I think, to consider in targeted ways. So thank you for raising that. Let's now talk broadly as a group on the role of technology, broadly speaking, in maternal and infant health now. I'm throwing this open. What's working? What have you learned that's working?
Sure,
I'll
start because I'll be quick. I think what we've learned, we've talked to over 40 companies, I would say, who are all probably less than 3 years old, who are all trying to do something in maternal health. We don't need more companies. We need these dots to get connected. So, you know, the one-dimensional new gadgets, new ideas that serve their own one specific purpose or kind of diagnose this one specific piece of information or sense this one thing or warn this one way, we don't need more of those. They need to be connected. So that's kind of where from my perspective, innovation really is necessary in this space.
And as Murad was saying before, the analysis of data, I think, is a huge part of connecting the dots. Because you're going to get all this data, and we got to figure out what to do with it and how to use it effectively. That, to me, is a huge challenge.
Sure. And big data and data analytics are clearly here at CES, and we'll hear more of it at conferences throughout the year, at HIMSS, the Health IT Conference, and other places. So that is job next, I think, because there's so much data that's not getting corralled, and we do live in a land of silos, right, in healthcare, unfortunately. Other ideas, so big data, connecting the dots. Dr. Smith, thoughts?
The other thing that I was thinking of is that, you know, again, what we do at NASA is we build a small craft and send people off in it. So being able to do things in a remote area, in situ capabilities, small, convenient, and those are the same technologies that can get you out into the field It's one thing to do things in a major city, but then, you know, the vast amount of people that live in rural areas where they don't have access to those things,
Right.
it's the same need.
So what Dr. Smith is hinting at is the concept of telehealth and telemedicine. And we know in the policy world, telemedicine and broadband to rural areas and to many urban areas hasn't filled the last mile yet. It's a huge investment that you can run education over, healthcare, lots of other applications. So again, it's a platform investment we see made in places like Finland and England and India and China that we haven't yet completed here in the U.S., the richest nation in the world.
But again, we're talking policy here.
Yes.
We're never going to make the investments we need to make in broadband, in infrastructure generally, in science and education and research if we're spending 2/3 of our budget on healthcare, about half of which is unnecessary because we've done such a poor job of preventing problems that we're presented with in the healthcare system because we're not administering all of this very well. So you're exactly right. I mean, broadband is an obvious solution. We needed it a long time ago, but we just don't put the dollars into it because they're all going to Medicare or, you know, other things that could be cut in half in terms of expenditure.
Right. So other technology thoughts
So,
over at CES?
yeah, I just wanted to veggie back off of Dr. Scott and just, you know, really bridging that gap in rural areas as well as urban environments, but also making that information culturally relative and bringing in that literacy piece. That's really, really important, and I can't stress that enough because it doesn't matter how much information you provide. If someone can't really understand it, it just doesn't make any sense to them. And as someone who I work with infant and maternal health here in an urban environment, but also overseas in Uganda, I've traveled back and forth in rural areas where, you know, we're conducting prenatal appointments with midwives and they have nothing. So really being able to have something that's small, that's tangible, that's easy to understand, that can go full spectrum across the board in terms of gender, in terms of religion and culture, so that it's very easy to understand would be wonderful. Yeah.
So two themes to draw out of what Chanel just said. One is the importance of user-centered design. That cannot be overemphasized. Is my friend Stuart Carton in the audience? Okay. Stuart runs Carton Design in Marina Del Rey. He's a great healthcare designer. There are many of them around. Again, no skin in that game. I just know he does great work. I think we need to really think about that in terms of what, if you're developing something, who's it for? Where are you trying to get? And work backward with the folks that you're aiming to help change behavior and impact. You can't just throw things out there, and we know that through work. I know I work with a lot of incubators in the East Coast, Blueprint Health, Startup Health, others, to look at new business plans. And a lot of young people are developing things for older people who are frailer. I'm not pointing to you as a frailer person, no. But you know, people who are more mature, less digitally literate. And the second issue is literacy. And when we think about health literacy, there are many layers to the onion. There's general education literacy. There's digital literacy. Do people know how to get on a computer? Do a Google search. Go to WebMD. Go to FDA.gov. So digital literacy, general literacy, health literacy. You leave the doctor with a prescription. Do you know how to really take it? I know in a work I just did with California Healthcare Foundation, we were working with a group of Hispanic patients in the Bay Area in a qualified health clinic, and the word ONCE was written on a prescription, and this was a young Hispanic woman taking care of her grandmother. She speaks Spanglish in everyday life with her friends, Spanish and English, but with grandma, abuelita, she only speaks Spanish. And they didn't know whether this prescription was for 11 pills, or a pills once a day, or one something, and you get in trouble when you don't have the cultural context in the development from the beginning, from Jump Street. So again, what you said was worth a lot. Literacy and then the design cannot be underestimated. So let's do a couple minutes of sort of summarizing. What have we talked about? What do you want people to take away from all of this? Murad?
I would say that there are multiple approaches to trying to attack this problem. It has to be collaborative. I don't think everybody needs to start their own thing. And I think a lot of the innovations actually happening in the work that are happening in communities like what Chanel's doing, which are high touch, and marrying high touch to high tech, which is what Scott does. And I kind of think that kind of approach, and with a policy overlay, is what we've learned over our course is an effective formula.
Yeah, I would have to agree with Murad. You know, it's just really about a collaborative effort, you know, really coming together as a collective and being able to bring in all the different assets that we have, right? So bringing in the policy, which is extremely important, bringing in the nutrition, you know, bringing in the tech, and really combining those things for one concentrated effort, right? To really address the life course. So, you know, starting from the very beginning, when a child is coming out of someone, and really going and realizing that everything that happens to that child from the day that they're born affects the choices that they're going to make as an adult, and when it comes to preconception care and beyond. So, yeah, definitely working together.
You know, again, what we look at NASA is exploration, and the role of nutrition in exploration is profound. We always look back historically, and the throwdown line I was used is that, you know, nutrition made or ruined many an exploration mission. When we talk about scurvy from folks that left Europe coming for the New World, scurvy killed more sailors than all other causes of death combined, including shipwrecks. And that was one single nutrient. And when we talk about the fact that, you know, your life is not a destination, it's a journey, in the same token, nutrition plays an incredible role from the moment of conception through those waning days at the end. Good nutrition can help change the course of that trip.
So beginning of life to me is the most important thing, if you really step back and think about it. But most of us kind of know about it in our personal life with our families, but we don't ever think about it very much. It's kind of a secret. It's covered up. So what I would say to the great audience here is, let's pull the curtain back. And I would hope that some in the audience today would want to bring their tremendous knowledge and skills and technology and ideas to help all of us do better with maternal health and infant health. We can do better. We're not doing well. These statistics are ridiculous. They are ridiculous. I mean, this is, you know, put the rest of the world aside. This is a wealthy country. And our maternal health statistics and infant mortality and infant health statistics are abysmal. We can do better. And we need the help of talented, smart, dedicated people like you to help us pull that curtain back and then apply your great ideas to make this better.
I was at sort of brainstorming salon last night with the company Philips, a very diverse group of developers, healthcare providers, press, brainstorming the issues in general about the islands of development and the blessings of all these niche technologies. And to a person standing up and opining in a group of about 40, 50 people, it was all about what Murad and the group is saying. We are in a health is an ecosystem. It's not any one thing. And the social determinants of health, all these different things we've been talking about, literacy and food and public policy and education, all play, they interplay. But everybody in this room does play a role. That is not a cliche. That is absolutely the fact. So as you walk the floor of CES upstairs and downstairs, please go to the Eureka area. Think about how you can help connect the dots here. Because we cannot solve this problem or any health problem in America unless we really do come together. And so thank you for coming to our session to kick off the 2 days of digital health. We really appreciate it. Thank you.